All right, you're live.
Good afternoon, everyone, and welcome to, I believe, a very exciting presentation. It's not very long, it's short, but it should be a little bit intense, and I would want some feedback towards the end of this presentation. So I want you to write all your questions down. I know you should have a lot of questions, and then just ask them towards the very end. All right. I'm going to move to share my screen with you right now. Um, let me do this again. Okay, perfect. So this afternoon, we will be talking a little bit about the biological effects of COVID on the brain. And this is just an interesting study for me. I am working directly with COVID patients. I do a lot of my therapy sessions in the nursing homes where we've had not elderly people as you would think about nursing home, but younger people who will have really suffered terribly from COVID and as a result have developed complications, hence, the need for skilled nursing care. And so I'm working directly with them, and I started seeing just a lot more mental health issues coming on. So I decided that I would do a little bit of a research on that area. And this is what my research turned up. So I want to share this with you. So in a report published by the Lancet Psychiatry, this is all this year. Of course, we're in the pandemic right now. They reported that COVID-19 survivor experienced mental health or neurological disorder within 6 months of the infection. So they're looking at persons who have gotten some um, gotten the COVID virus and have recovered as we know it right now. Researchers analyzed data from 236,000 patients diagnosed with COVID 19 and found that 34% had mental health issues. So they're saying that one in every three persons who recover from COVID will show mental health problems within 6 months. Out of a total of 14 brain disorders, these were some of the ones that were identified. I'm trying to move this so I can see better. Yeah. So the brain disorders, mood, anxiety were the most common, followed by substance use disorder and insomnia. Another 2.1% ended up with ischemic stroke, 0.7% dementia, and 0.6% brain hemorrhage. According to Dr. Maura Boldrini from Johns Hopkins University, about, hold on one second. Give me one second. Sorry. Yeah. Neurobiological changes in the brain caused by inflammation affects cognitive and biologic behavioral symptoms. Since the pandemic, many neurobiologists have been studying the COVID-19 infection and mental health. They have observed that patients recovering from COVID-19 have a new onset of delusions, hallucinations, anxiety, and depression. So, how does the virus affect the brain? Neurobiologists believe new psychiatric symptoms may be caused by the body's response to the virus, triggering the release of a chemical known as cytokines in specific areas of the brain associated with psychiatric conditions. These include, of course, we know the amygdala deals with a lot of the emotion stuff, the hippocampus, the nucleus accumbens. Increased cytokines disrupt the production of neurotransmitters, which are natural chemicals which allow the brain to communicate to each other. The COVID-19 inflammation could also contribute to the death of these brain cells. So we know that a lot of mental illness takes place in the amygdala, the hippocampus, and the nucleus accumbens. The nucleus accumbens is primarily responsible for addiction. So with the increase in cytokines in that area, we are expecting to see just a little bit more of substance use disorders and other mental health issues as well. The COVID-19 infection often associated with small blood clots and inflammation. So it kills, because of these blood clots and these inflammation happening in the brain, additional nerve cells are killed. When viewed during MRI scans and EEG scans, the individual's brain resembles persons with traumatic brain injury, as in the football players. And we know recently there have been several studies on football players, and they're saying that, you know, once their career is finished, they'll, you know, they're a lot of them end up with Parkinson's and Alzheimer's from damage to their brain. And they're saying that people who recover from COVID-19, their brain looks very similar to those of who played football, who had multiple concussions, who had, you know, traumatic brain injury. And these lead to rapid changes in personality, aggression, anxiety, and even suicidality. Extensive studies are being done on analyzing, give me 1 second, let me put this back down, analyzing the electronic health records of deceased COVID-19 patients who presented neuropsychiatric symptoms. They're also analyzing their brain tissue in detail, looking for pathogenic pathways, measuring microglia, cell damage, and other inflammatory markers in the brain of these patients. Although controversial, it is believed that COVID-19 virus can enter the blood-brain barrier. So we know the blood-brain barrier is kind of that protective sheath over the brain. And they're saying that, you know, it's very, very few chemicals can actually seep through the blood-brain barrier. Water is one because of its low molecular makeup, and also like alcohol. They're actually saying that the COVID-19 virus enters the blood-brain barrier. So it seeps through the blood-brain barrier. And in 3 people studied who died from the COVID-19 complications, the National Institute on Health supported research detecting signs of COVID-19 in the neurons in the brain, cerebral cortex. So they're actually seeing the virus inside the brain. In another study published in the Journal of Neurobiology of Disease, researchers found COVID-19 spike protein could cross the blood-brain barrier and infect brain cells. Although researchers believe the COVID-19 virus can enter the brainstem and the cerebellum through the circumventricular organs. So we know that COVID-19 is associated with loss of taste and loss of smell. So it does affect those circumventricular organs. And so the loss of smell that occurs in some patients with COVID-19 could indicate that the virus entered through the olfactory bulb, which is located right above the nose and communicates information about smell to the brain. So the virus enters the olfactory bulb and travels all the way directly into the brain. And so that's why it's able to be so, you know, damaging to brain cells. So other ways COVID-19 affects the brain would be through confusion, loss of consciousness, seizures, stroke, continued loss of smell and taste. So for persons who have recovered from COVID, quite a number of persons still report that they cannot taste or they cannot smell. My coworker contracted COVID about 6 months ago. And since that time, she has not been able to smell anything. She's not been able to, she said she can taste bitter. She can't taste sweet. And she also developed a heart condition. So this is really, really significant about the, the continued symptoms that we get even after we have so-called recovered from COVID. Headaches, trouble focusing. A lot of persons say they have brain fog or just gaps in memory. They can't remember stuff. Even if the brain identifies what they're trying to say, they're not able to put it in words. We see a lot of changes in behaviors. There's also peripheral nerve issues such as the Guillain-Barré syndrome, which can lead to paralysis or respiratory failure. Changes in the body from high fevers to low, from low oxygen levels to multiple organ failures, having such high fevers account for brain dysfunction such as delirium or even coma. So we're seeing even just having the fevers alone can lead to a lot of brain issue, delirium, or coma. Increase in strokes in young people due to hyperactive blood clotting systems, which is usually more active in younger adults. This increases risk of blood clots. We're seeing a lot more blood clots in younger people. So what does this mean for nursing care? What does this mean for medicine? Projections suggest a major surge in post-acute care demand, which occur following the hospital surge involving patients with COVID-19. So we will see more post-acute treatment necessary for persons with COVID-19, who have had COVID-19. The discharge of patients with COVID-19 from hospitals are complicated. You heal, you get to go home, and your family members are really happy that you're okay in their mind. But some of the issues, have started, the personality issues, the mental health issues, other health issues, such as stroke and blood clotting and all that we just talked about. Those things complicates the case. So it's not a clean recovery that you're going to go home and be okay. You're going to go home without smell and taste. Besides increased infection, we'll be seeing more mental health conditions as well and behaviors. We'll see increase in problem behaviors. So we will see with we all know the story of Phineas Gage, that guy who was a construction worker, and they said, the nicest guy ever. And on the construction site that he was working, there was a piece of steel that went to his brain and damaged areas of his amygdala and his hippocampus. And once he was healed, he didn't die, but he became a totally different person. And from that incident, a lot of scientists and psychologists and psychiatrists, they all started studying how damage to these particular parts of your brain affects your behaviors. And so now we know that. And with the increased damage to the hippocampus, the amygdala, the nucleus accumbens, we'll see more aggression. We'll see memory loss, brain fog. We'll see more wandering, even for the elderly population who have recovered from COVID. These are some of the additional behaviors that we will expect to see. We'll expect to see delirium, delusions, hallucinations, anxiety, and much more depression. We'll also see psychosis. What is psychosis? So psychosis is what we really refer to as madness, insanity. That's kind of the worst one in our mind. It's really like people with schizophrenia that would, show psychosis, or people with substance-induced psychosis. But psychosis is really, you're presenting with hallucinations, you're presenting with delusions, you're presenting with, bizarre behaviors. And this is when you actually sometimes will need to be hospitalized and really be put on heavy medications, for you to be controlling of certain behaviors. We'll see more of that. We'll see much more substance use. We'll see overdoses because, once we have an increase in substance use, we're going to have more, overdoses. So expect that we'll have more overdose deaths as well. We'll see medication seeking behaviors, because that comes with the territory of substance use. We'll see a lot of manipulation, persons who will be manipulating even nurses, doctors to get additional medications who really don't want to go to street drugs. We'll see additional mental health diagnoses, such as Wernicke's, severe dementia, damage to the brain. We will see Carcassonne syndrome. We'll see more Parkinson's, mental health disorders, as I mentioned earlier, depression, anxiety, suicidality, substance use disorder. So how do we, care plan as nurses for these COVID-19 patients? We have to, plan a lot of extra activities, group meetings, assessments, staff training and education, revise care plans, update care plans, family meetings, room searches, more behavior meetings, safety contracts. And how do we plan as family members for these COVID-19 behaviors? Well, we just have to coordinate more with our medical team. We have to, be much more supportive. We have to be very observant in looking for these behaviors and just be very proactive in helping these persons to get the necessary help before it's kind of way gone, right? So everyone has to really be looking out for these behaviors and recognizing them very early and moving towards treating them. For the doctors, for the nurses who are on, assess suicidal behaviors and implement one-on-one if necessary, psychiatric or mental health evaluation and or treatment. We do EAP referrals for persons who are working with these individuals, maybe go to HR and, saying what your observations are. HR can do an EAP referral for that person to go and get counseling. But if you notice as a coworker that someone is struggling and having new behaviors that you never saw before COVID, you might want to help them. You might want to reach out. You might want to go to your supervisor, go to your boss, not in a way to get them fired or get them hemmed up, but in a way to get them the help that they need. For the employers, you want to encourage more staff vacations. You want to prevent staff burnout. You want to prevent vicarious traumatization. And you also, for everyone, you want to encourage self-care. That's super important because I know a lot of nurses, a lot of essential workers right now have not even had the opportunity to get vacation because they are working, for over a year straight. Some people not even the ability to get a day off. And so it's very, very important that they, we recognize burnout and treat it before it gets to that stage. So, vicarious traumatization is horrible. And I believe that vicarious traumatization is noticeable among healthcare workers. So the doctors and the nurses are most at risk. Anyone working directly with the COVID-19 patients are really at high risk. And so, now is the time when you should think about taking some vacation since we're vaccinated and we're all, not under so much stress again, and not many people are dying as before or even contracting the virus as before. Now's the time for you to start looking at taking care of yourself. So I'm going to stop sharing for a while and let's see if we can open the floor up to questions. So I'm not sure how to unmute you. So what I'm going to do is just ask you to unmute. And if you have questions and you want to put it in the chat, feel free to do so. But I wish let me see if I could. I don't know if I can unmute you. You can unmute yourselves, it says. So if you have any questions, go right ahead and unmute yourself. We have 109 participants, so I would imagine that you would have questions. So not only that COVID-19 is a health hazard or a health issue, COVID-19 is a mental health issue. COVID-19 is substance use issue. You know, it stretches so much beyond that. I would therefore encourage everyone to take, hosts need to allow us to unmute. Bev, are you on? If you're the co-host and you're able to unmute.
Yes, I'm here and I can unmute anyone who needs to be unmuted.
Perfect. Can you unmute everyone so that everyone has the ability to just ask questions?
Okay. Okay.
Thank you.
Good afternoon, everyone.
Good afternoon.
I am Fiona from Percy Junior Hospital. You know, the other day I noticed one of our staff member, after 2 months of being infected with the COVID-19, she was showing behavior such as memory loss, where she started writing her nurse's notes and realized that she was not completing the notes. So when we call her in as supervisors, she was saying that she was not aware of such. I just want to know though, when should we make these referrals for these persons? Because we thought that was really to the extreme and it happened more than on one occasion.
Wow.
And this was a nurse who we know would do her work very well. And she would start the notes, reach to the middle of it, and then we notice it was not completed. So
wow.
At what point should these persons be referred, you know,
so
for
what it
assessment?
seems like she's experiencing is brain fog.
Okay.
And because the virus is new and we don't know too much about the long-term effects of the virus, we don't know, because persons who have had COVID in 6 months ago still experience loss of taste and loss of smell. So we don't know the long-term effects of this virus. We don't know how long this brain fog will continue. So I would think that you would want to make that referral really, really quickly, Fiona, so that in the event that, you know, she can be treated by a neurobiologist or neurologist, that be done right away.
Okay, so what we have done is just that we allow one of our colleagues just to keep checking to see when she's doing the work and to ensure that it is completed, just to assist her.
Right, and that's a good start because that is you supporting her. But in terms of her own mental health, I don't know if that isn't a way to address that, because you really want her to get treatment for her own mental health, you know? So it's good to support.
Yeah, that is true.
But I think that she needs to see someone about that particular issue.
Okay,
yeah.
Thank you very much.
You're very welcome.
Marcia?
Yes, Joan.
I'm with the JNAS. How possible is this to have make this seminar or webinar available?
You just cut out. You just unmuted, Joan. So I heard how possible is it, and then
yes. Thank you for a wonderful presentation. How possible is it to make this webinar available? Because there are just so many valuable information you have shared that I as a part is, especially the part about even the employers are realizing and seeing the different changes, personality changes, which can lead to someone losing their job.
That's true.
So I find that this is very valuable. How could we get this again so we can share it? Because I really see there's so many things you express or explain here that I've also identified and see with others. And I think this could be a very important part. So we become aware of, especially now when, you know, people might be so quickly to reputation or take action against the staff member. So is it possible for you to make this available?
Oh, absolutely. So I know that this is being recorded right now. I know it will be available on YouTube, but John, I am much more willing to do a second training for you. you know. I'm willing to do another training if you want me to. So, yeah.
Thank you.
Yes.
There's a,
Carol had a question.
Yes.
there's a call.
Thanks. Can I come in now?
Absolutely.
Thank you. I am a teacher, and I know quite a number of, I'm actually calling from England. Quite a number of teachers have suffered from long COVID. And at this time of the year, we were very pressured in terms of, even though the examinations have been canceled, but teachers have to give the students test the mark and all of that. And there's a lot of pressure going on. And there are a lot of teachers who actually have, you know, like other symptoms where they don't really want to be at work, but they're forced to be there.
You're breaking up a little bit, Carol.
So how can we actually support our peers, or just ensure that, can you hear me now?
I'm hearing you now.
Yeah, I just want some suggestion, because I am in the union support teachers, but what are some of the advice I can give, like, to those who have suffered from the long COVID, or those who are, you know, clinically vulnerable and, you know, still have to be at work, but, you know, they're under immense pressure from, say, who want them to be in work and they don't want to be there. So what's some advice, you know, you can actually give me to support those members?
They must start from 2 o'clock, might be a 3 o'clock different time.
Talking. So here's what there are. So COVID-19 has had multiple repercussions for people. So we already had a large number of persons who were prone to depression, who were prone to anxiety disorders, who were, you know, traumatized, and who suffered from PTSD. And not only that, people suffer from grief and loss and adjustment disorders and so on and so forth. So I believe that we all have to be our own brothers keepers right now and just look for these symptoms. So if we never knew the symptoms of depression, you know, just go on Google and Google the symptoms of depression. Google the symptoms of post-traumatic stress disorder. And if we're, you know, anxiety disorder, if we're seeing these symptoms popping up and we're identifying them with other co-workers, then we really, really should be helping them, you know, by whatever means. As I said, you know, maybe go to a supervisor, go to HR, go call the person one-on-one if you have that relationship.
Out of 100. Where was I when I get this homework?
So there's somebody talking about a homework situation. Yeah. So I think that, you know, that's the first approach, is really one-on-one and helping this person. But also too, if you see your coworkers struggling and you're able to, as the other nurse, as Fiona said, you know, if you're able to help that person, if you have one person who can jump in and help to mark some papers, or, you know, we all have to, like, look out for each other right now and be our brothers keepers. But I also think that, you know, we underestimate COVID effect on teenagers or children. And you know, these children who are sitting these tests and all these exams, they also are suffering from the effects of COVID-19 too. It might not be as extensive as elderly population or even middle-aged, but I would think that it would affect them in much the same, because I've also heard young people say, I don't have any taste or smell. So if we know that it also, you know, went into their olfactory bulb, went up to their brain and might have damaged, although we know that the brain, there's neuroplasticity of the brain. We know that the brain can now heal itself, but I still think there might be some damage.
Could you just ask them, whoever is not actually asking a question, to mute themselves so it won't interrupt others and yourself? So just repeat that again, please, doctor. Thank you. Yeah,
so guys, if you're not asking questions, just please mute your mic. It's to the very, very left corner of your screen, and there's a little mic icon so that, you know, it doesn't disturb others. So I basically was saying that we have underestimated the effect of COVID-19 on teenagers and, you know, children, but they too suffer long-term damage. I mean, we've had persons still reporting that they can't taste or smell. So we don't know to the extent of which their brain has been damaged as well. And I'm saying, you know, at this point in time, we really have to be each other's, you know, our brother's keeper. And so if we are identifying these symptoms, that we really should do one-on-one with these persons, or even jump in and assist when we can. You know, as one of the other nurses mentioned earlier, have another nurse complete or have another teacher help out. But I think that even for teachers, it's very important for us to stop now, stop for a while and do some self-care, because a lot of us are heading towards burnout. Any other questions? No other questions? We have 129 persons online.
Yes.
Good afternoon.
Good afternoon.
This is Erica Myers, Black River Hospital, Jamaica.
Hi, Erica. Welcome.
Thanks so much for such valuable information. My question is, would it be a good idea to take a multidisciplinary approach to management of the COVID-19 patients? That is, instead of just our medical personnel seeing the patients, we could also add our mental health team just for quick assessment so we can identify these conditions early or prevent them so we treat them prophylactically.
That's it. You brought up a great point. We have to use a holistic approach. We have to use a muted. Sorry, the host muted everyone, including me. So I'm not sure where I popped off, but we really have to take a multidisciplinary approach to treatment. Absolutely. So even as nurses, we can't just focus on the medical right now. We have to look out for these mental health symptoms, the delirium, the hallucinations, and address them as such. Thank you. That's a great point.
I have a question.
Absolutely.
Can I go ahead?
Oh, yes, go right ahead.
Okay, I am Eric Brown. All right. So good afternoon to everyone. Yes, I would like to know, how is it that we have so much information on the effects of COVID on the brain in terms of the source?
Mm-hmm.
And I would also like to say that the communication aspect of it is that when you have patients on like COVID wards and so forth,
mm-hmm.
it would be good if you are able to communicate with them.
Mm-hmm.
And it has to be a case where the isolation itself, by the nature of the disease, I believe, I think that's one problem. So if while they are in, we can communicate with them, that is also something that can help those persons. I would agree that in this time we need to care for the other person, but to an extent we have to be careful because we might overstep. So I am just suggesting that you work out some kind of protocol in how it is done. The person must be contacted first, perhaps get their consent or something, and it might be kept confidential so that if you're assisting the person can get the expert advice without, undue persons knowing and being aware of it. If you have a problem, usually I think persons want to know that any medical advice for that individual is kept confidential, even though the help must be open. So I'm just suggesting that, and I would also like to say that this is actually the first time I am seeing the professional side, the people who should be running to the mic to give the information, being proactive rather than waiting on person to come in. So I have to commend you for that. And as I hear the lady speak about a teacher there, and she's a teacher, I'm also a teacher. And I'm saying that within the schools, we have to get, we have to find a way to give the teachers more support in working smarter. As a matter of fact, everybody has to work smarter instead of harder now because you have more pressure. So that's all I'm going to say.
You said a lot, though. You said a lot. So thank you so much. So one, I agree. We have to work on some protocols, you know, in how we would help each other. That's very, very, very important. But I mean, as teachers, as nurses, everyone in our mental health or medical field, we already know the value of HIPAA. So that should, you know, go without a say that whatever information that we have on the person, that's confidential. In addition to that, though, the flip side to that is, to what extent is this person presenting with mental health issues? Because, Eric, if they are presenting with hallucinations and delusions, they can't make real rational decisions and sign consent. That would be much more. In the United States here, we refer to that as Section 12, you know, or a Section 35, where families are able to go to the court and say, hey, my family member is suffering from mental health issues or substance use issues. I don't think they're able to make any real rational decisions or even to give consent. And for Section 12, it's you send them to the hospital without making any consent. So I guess it depends. If they're just mild depression or mild anxiety, yes, they can give consent. But if it's really to the level of psychosis, then they're not able to make these consents. So as part of our protocol, it would really be interesting for us to put those in place as well. Yeah. So Jahim, your hand is raised. Yes. There are two people. Let's do Jahim first and then Miss C. Jahim, unmute yourself and go ahead.
All right, good evening, everyone.
Good evening.
I would like to commend you on your presentation today. However, I would like to add, with all of this information that is presented, I'm a teacher and I know at my organization, I remember at one point a teacher was asking, what are the protocols in reporting your condition, because of the same level of confidentiality that you would want to hold on your disease? How is it that you are feeling? Some of the things that you would now be facing based on the fact that you would have contracted, you would have known someone with the COVID virus, and you want to protect yourself. You also want to protect your students. Now, organization, and this must be mandatory, that means they must have to come up with a plan, and this must be passed on to all the workers to say that if you have the virus, if you know someone who is close within your household with the virus, we are asking that you report this to the guidance counselor. We're asking that you report this to the vice principal, but it must be documented who you report this to. Because I can tell you, I know a lot of persons who probably have symptoms, some persons who don't, and they probably have the virus itself, and they are afraid to go within the organization and tell these persons, and even to share and get support. So it must be mandatory that organization at this time be aware that they need to have a document to say, I am going to report this to a particular person, and this information will be kept confidential. The symptoms too, sometimes you might be having the symptoms, but you're not even sure who to share with. So some of those things, as your support unit within the organization, must be clearly stated, and who are the confidential persons. Thank you very much.
I totally agree with you. So here in the United States, we do what we call contact tracing too. So there's the Department of Public Health that whenever you do a test, whenever you do any testing and there's a positive, then that is reported to that department. And the department will do contact tracing and reach out to everyone who you have come in contact with within a few days of, the incubation period. So I'm not sure if they have that in Jamaica. I would hope that they have something very similar, because it's super important that persons who you come in contact with are informed of their risk of contracting COVID. But also too, there must be a system in place to be able to check and to end up getting statistics on persons with COVID virus. How is it that they would be able to tell who contracted the virus and how many people are not? So there must be a system. But in addition to that, each organization, each agency should have their own protocol and their own system of getting this data information. And I think there are some HIPAA concern with COVID. I'm not sure if the CDC have specific laws around HIPAA and COVID. I probably should do some research on that for you.
There is such a system in Jamaica. We do have contact tracing and follow through.
Good. Perfect. So there should be able to inform others whenever you have symptoms or anything like that. Yeah.
Well, Marcia, can you hear me?
Yes, I can hear you.
This is Joan. So
yes.
you're sharing this information with us is very important for all of us, and not just us as healthcare or teachers, but for us to make sure we educate in the community. These are some of what are the fallouts after you have had the COVID-19. So it brings awareness, not just to even the person who have it, but others who do not have it. So when you are experiencing some new dynamics with that individual, whether it's a student or worker, you become more aware, more concerned, more compassionate, more understanding, and less judgmental. So it's not even say you're divulging information about someone or you want to hide that you have it or you didn't have it. Is the awareness that we need to have that these are new findings that we are seeing across the spectrum with individuals who have had the COVID-19. So that is the vital education. And I really thank you for bringing this out, so we don't go ahead and say, why is Aunt acting so straight? Right. No, Aunt have Alzheimer or dementia. And it also stopped maybe sometimes the abuse that would have gone on or the misunderstanding. So you realize that, something happened. COVID could be a factor of it, and the awareness is coming out. So it needs to be even on the air, in the newspaper, on the TV, on the radio. These are stuff that could be coming out, that are coming out now, and science are seeing these things. Like you have cancer, what are some of the signs and symptoms? What are some of when you have a post-traumatic stress disorder from any other injury or some childhood effect? These are the awareness. So this is a very vital information you're sharing to bring to our awareness.
Yes. And I just want to quickly add to that, not only am I speaking on the biological effects of COVID, but when you talk about mental health, you're talking about much more depression, because just isolation alone, we know, increases the symptoms of depression. So we're seeing more depressed people. We're going to be seeing more sexual abuse, because when you have the abusers locked in a home, quarantined with the victims, there's just more abuse. So we're going to see more sexual abuse. We're going to see more domestic violence. We're going to see more substance use. People who are locked in and have no way of, expressing themselves will turn more to drugs and alcohol, So it's not only just we're looking at this biological effect, we're looking about its severe mental health issues. So I can't imagine what the next 2 years will look like once the COVID vaccine is behind us and we're now like, it's like a hurricane and it passes over and we're clearing up, you know, and we're looking at all the damage. That's kind of what it's going to look like for COVID-19. But Eric, you had asked a very important question and I didn't respond to. You said, how is it that we have so much data on this? It's not that we have so much data, it's that we're studying right now. So a lot of the neurobiologists, a lot of the scientists are actually taking the people who have died from COVID, they're taking their brain and they're studying their brain as we speak. They are interviewing people who have recovered from COVID. They are looking in the nursing homes, they're looking at the elderly population and how they present after. They're looking at medical records. So if you had, you know, if you didn't have a predisposition to mental illness and you never had mental illness, you never had a diagnosis before, now you're turning up with these diagnoses, but you had COVID. They're looking at all that. So it's a lot of studies going on, and not just in mental health. I'm pretty sure that there's a lot of medical studies going on with COVID because they need to understand this virus. You know, it might be around for a while, and so we need to manage it. Moreover, we need to manage it now. It's killing so many people. So it's just a lot of studies that's taking place right now. And luckily for us, we have the internet. We have, you know, means in which we can turn out this information real fast. I can't imagine what this was like in 1918 to 1920 when they had the Spanish flu. You know, the information couldn't have gotten out so quickly because they never had the internet like what we do now. But now we have, you know, many sources of, we have a cell phone, they can put it out there, you know, they can create alarms. There's just so many ways of turning out this kind of information. So I'm really happy that we have it.
We have 2 hands up, Erica and Joy Guthrie. I'm not sure which one went up first, but you could just take them in that order. Erica,
go ahead with your question.
Thank you much. Just to shed some light on what the teacher was saying about the confidentiality and all that and how you go get tested. I know within the health sector, like in the hospital or the primary care setting, what happens is if a staff is exposed to COVID-19 and they are tested positive, the only persons that there is a chain of command that it is not directly reported to the infection control personnel, but the person has to be away from home, away from work rather. Therefore, the infection control personnel will have to know. Okay. And then it is passed on to HR. Okay. If another coworker was exposed to this person, the person would be informed by contact tracing to say you were exposed to a positive person. They will not say the name or anything. They will just let you know and find out if you are having symptoms and offer for you to come in for testing. If a person is placed in isolation at the end of their isolation, or if they are placed in quarantine at the end of that period, they are released from quarantine by public health. They are given a quarantine release paper to take back to your supervisor to go to the HR department. So not all the hospital will know. And she had concern about testing. Each parish have an emergency operation center that does have a number. So if you are having symptoms, you are asked to call and they will instruct you where and when to come in for testing. If you are not getting through on that, we have the 8881 love. You can call and get information about testing if you're having symptoms.
Nice. Thank you so much. That is so much information for us. I hope we're all writing these things down for persons who are curious. And I just want to stress that the purpose of JDTAN is really to do this, is to collaborate with you guys on the ground in Jamaica to do more education and training, and also for you, the healthcare workers, the teachers, the doctors, to be able to translate that information to the community, to be able to train the community. So I'm glad we're having this discussion. I am very open to anytime you guys are ready for us to do this again. And just to stress that this is why we are part of JDTAN.
There's also a question from Joy Guthrie.
Yes, Joy, go ahead.
Hi, good afternoon, everyone. I came on a little bit late. I hope I'm not repeating something that was already addressed. I recently became vaccinated with the Moderna. And, the night after I got my second dose, I experienced I was driving and I was like 5 minutes away from home and I couldn't find my way home. Got lost like 3 times.
Wow.
Very scary. I know brain fog is supposed to be one of the effects of the COVID infection.
It is. So we did talk about brain fog being one of the symptoms, and we're saying we're not even sure how long this brain fog will last after you recover from COVID.
Right. I never had COVID, thankfully, but it was just the vaccine. So I was just curious. The case of brain fog I had that night. Wow. I was sick for a couple of days after the vaccine. So I'm sure, because like the first day I had felt like I had a bad case of the flu. The next day after the vaccine, and the day after I was extremely fatigued.
Yeah,
and I had the night after the vaccine.
Yeah,
but but if that's something that does happen to people, I'm sorry to interrupt you.
No, go ahead. I interrupted you.
There, so at least you can be forewarned. Like you probably shouldn't be driving or something, because I could have probably gotten into an accident.
Wow, that's significant. So yes, so it's important for us to recognize and understand these symptoms, especially once we get the vaccine too. Those come with symptoms as well. Unfortunately, it's not just that you get the vaccine and nothing happens. Some people have different symptoms. So yes, and brain fog is one of them that's reported. I'm hoping though that it's not as long-term as if you were to contract the virus itself.
I think I'm pretty okay now, but that night I was really scared because I couldn't understand how I couldn't get home.
Wow.
So I was about to call for assistance because I said, what am I doing? How can I not find my house? I could possibly have walked home from where I was. It was so close.
And you couldn't find it. Your brain
I looked at her, I was like, where am I? I became very, very confused.
Wow.
I was on my street and I passed and I recognized that I passed my house. I did a U-turn and passed my house again. So that was weird.
Somebody just said something about blood clot. Yes, that was one of the symptoms that we reported, that persons are actually getting increased blood clot from contracting the COVID vaccine.
I'm sorry, a quick follow-up question. You're having blood clots, what do you look for?
Maybe one of the nurses can help me. I know for blood clot, especially like in the head, would be severe headaches, and it would be like an onset of like the nastiest headache you could possibly get, or pain in that area. I don't know what other symptoms, but I know Dr. Gordon is a nurse and we have many nurses on. So guys, could you tell me what are some of the symptoms of blood clot?
Well, it depends on where the blood clot is, but things like, you could have pain in your calf, the calf in your leg, or you could have sudden chest pain also could be other possible signs.
Yeah.
I don't know if anyone can think of any other that they should mention, but those are two definite ones.
Hello, Marcia, Dr. Gordon. Hi, this is Lorna from JDTAN. Yes, Dr. Gordon, I agree with you. It just depends on where the clot is. I know there are quite a few deaths. What probably happened is the clot probably traveled from the leg and then go into the lungs and probably had a pulmonary embolism, or it can go to the brain and cause a stroke, definitely, and cause death from there as well. But I must say that COVID-19, Marcia, as you mentioned, we're learning so much because it's a new virus. It's been a year, but just today, I don't know if you heard this, Marcia, that they now develop, find out that for the teenagers, they now are developing case of myocarditis as well. Post Moderna vaccine. So when I heard it today, I said, "Oh my goodness!" Because can you imagine the anti-vacciners? Are hearing this, that, oh my God, not get the vaccine, my heart is going to go back. So that was made known just, I think today I heard that. So the healthcare workers now, the healthcare practitioners have to make this known, that there's a possibility that you may end up with myocarditis. So it's a new virus and things are going to be evolving. That doesn't say you shouldn't really look at the amount of people who have been vaccinated, and this one amount end up, unfortunately, with these the blood clots that have died, or now with the myocarditis, and the kids are end up with another kind of syndrome as well, that the adults tend not to have. So it's evolving. We just have to be very alert, very astute, with the science and the evolving information. And Marcia, again, I thank you, and I agree with Joan that this needs to be made well known, not only among the healthcare workers, because as you say, my neighbors next door, all three times, your family, they all had COVID, and the teenager was getting a bit depressed as well. So this is very near to me, my neighbors next door, so, and I can share that with them as well. So thank you very much. It's a very great presentation.
Thank you.
There's another question in the chat from Thompson. It says, is it safe to take aspirin before taking the COVID vaccine? What effect will it have on the body?
So I'm not sure how to answer that question, given that I'm not a medical personnel.
I think that was, I was listening to one of the doctors on one of the TV stations, and this question was asked, and the response was no, from a physician. Yeah, I did hear this question, but when the incidence of blood clots kept on, being more well known, although it's such a small amount of people who got the blood clots. So this question was asked, and the doctor said no. No, aspirin.
Thank you so much for answering that. Yeah.
Another, since Lorna, thank you for the very important point about the students. So those of us who are also engaged in sports medicine and clearance for returning back to school for sports medicine for students, that's another important factor gonna have to be noted now, because you're gonna see probably more not say fatality per se, but more concerns, fainting on the sports team, whether it's soccer, whether it's baseball, whatever it is. So these are some things that even us or the healthcare or people in sports medicine got to be aware that it's not just an adult issue, it's now a teenager, it's on the sports team, it's in the athletes or athletes. So all those screening has to be aware of now. I know what they're doing with finding the clots a lot is most of these patients that either go in with unknown expectation with mental issues or brain fog, they're doing these CT scans and then they're doing the MRIs, and their autopsies that they're performing on the patients that have had COVID, they see that there was just many blood clots, because patients that we have cared for, especially those that were going on ECMO machines, you realize that these patients had to be on a lot of heparin and all these anticoagulants because they were having so much blood clots that they couldn't understand. I remember getting blood from a patient, and what's coming into that needle was just clots coming into the tube. So they're seeing that if you're not having the intensity to the severity of, say, on an ECMO, but these are going on a very small scale within the body. And when they're doing some of these ultrasounds for DVT, they find that these things were showing up more frequently in population that it was not expected to be in. So as you said about the ongoing science that has been taking place and an experiment, and they're still diagnosing, and they see that across the spectrum on brain testing that has gone to show how many patients had blood clot or the tremendous amount of blood clots that they have.
Yes, so much so. Someone just wrote on the chat that we should type the 2 effects, but I'm not clear. Could you clarify what 2 effects you wanted us to type in? 2 effects of, would it be like mental health? Because we had a lot of different effects, so I'm not sure which exact one you were talking or referring to. No, yeah. The one for children. So it might be, I'm not sure who spoke on the side effects for children just now.
I don't know if you mentioned what I mentioned about the myocarditis that came out just a few days ago.
Myocarditis.
Yes, myocarditis. Yes. Okay, myocarditis, yeah, and that was just recently being discovered in children. Yeah, I'll type it in.
Myocarditis.
Okay, there's somebody with their hand raised, Sparkling Harris.
Yes.
Thank you. Thanks for an awesome presentation.
Thank you.
I wanted to say as well that COVID has entered into our schema and has just shaken up everything that can be shaken. So now the way forward I'm seeing is that we can't do anything the same old way anymore. And as we practice, we have to now be open to anything is possible kind of attitude towards our practice wherever we are, in whatever field we operate, because we just don't know what will come at us and what we may miss in the process, because we are sticking to what we know, so to speak, and miss a wealth of things that can be unveiled. So now it is, we have a dilemma on our hands because we can't do everything, but at the same time we have to approach care and just dealing with others with an attitude of love and openness to anything is possible, and we ought not to overlook or take for granted anything anymore. Because it's like going to school now, starting all over again, and say we have to learn a new way of doing what we took for granted before.
Absolutely. And even for like the younger people, I hear a lot of feedback coming from Jamaica, you know, that them say, man, the old people them are dead. No young people not dead. But they're not realizing that even though you might not necessarily die from COVID, the long-term effects are
so great.
Yes, great. So, you know, they're angry at the quarantine, they're angry at this, you know, curfew time, but they are not recognizing that COVID is not just that you die or you live. It's about your lifestyle after that. It's about your health after this is all said and done, you know?
But also we have to consider that the fear factor, the herd fear factor, has a great impact on how people behave, the attitudes of people right now. Because when you don't know is one thing, but when you don't know that you don't know, it's a dangerous thing.
Yeah, that's dangerous. Yes.
And we have a lot of that happening. It's not just just being naive one, but also being dismissive about it. It's that we have a serious case of we don't know, and we don't even know what it is that we're supposed to know in all of this. So the fear factor is great in how people respond as well, because sometimes we assume that because, for example, we're dealing with adults are supposed to behave a particular way. No way, not in this age. And also, we have a population of adults who have failed our youngsters as well in many ways. So therefore, we have that burden on the plate as well as we go forward.
And it's not just a population, it's people that we thought would have known much better. It's professionals that they look up to.
Right. So that's why I say we have a population of adults, because really we have dropped the ball big time in many ways, even without COVID. So now COVID has come in to show us up in diverse ways.
Yes.
You know, but we trust that out of all of this, good sense will prevail. We trust that out of all of this, love for our neighbor will prevail, because we need a lot of that now in ways that we never thought humanly possible.
That's true.
In order to navigate what we have on hand.
Yes, that's true. So there's a question that asked about sensitivity to the teeth. I've not heard anything that the vaccine contributes to sensitivity to the teeth. And from someone who has been in the dental field, like myself, that's something that I would be onto right away, and I've not heard anything like that. No.
But even that we have to consider now, because it just might be something.
That's true. That's true, because we don't know, right? We don't know. Yeah. And then someone had typed something about pre-existing conditions that have been dormant. Now they're seeing it exacerbated by after receiving the vaccine. So they're saying, you know, she's saying, why don't we talk about that? It's just so many things that we need to talk about. The vaccine is a totally different presentation, you know? We can talk about that and all the different aspects and what people are reporting and what's being studied. It's just so many aspects of COVID that are new to us and are being studied. So yes, we do have many, many more presentations to come.
And I'm happy to hear that, because this is excellent.
Thank you. Well, all right, we've gone over 5:06, so this was so interesting. I enjoyed all of you guys. I am looking forward to another presentation with our JDTAN. I just want to stress that Dr. Gordon is on board. Dr. Gordon is actually the chairperson for the Health Task Force for JDTAN, and I am the vice chair for the JDTAN. So we're looking forward to putting on more interesting, informative presentations in the future. And we really want that. We have 162 persons with us today, and we're looking for similar and more for our next presentation. We're very happy to be able to do this collaboration. We're looking forward to collaborating more. And this is kind of what our goal is for JDTAN. And we want to be able to educate all of, you know, our fellow Jamaicans, and also for our fellow Jamaicans to educate us, because I also learned a lot from you today. So thank you so very much for participating, and have yourself a wonderful afternoon. All right, thank you guys.
Thank you.